Hello, I will be talking about tuberculosis. My name is Shauna Gunaratney. I'm an HIV and infectious disease attending physician at Columbia Medical Center. Our roadmap today will talk about epidemiology of tuberculosis, followed by microbiology and pathophysiology. We'll talk about the difference between latent TB infection and active TB disease, the clinical presentation of TB, and then finally diagnostics. So in terms of the global burden of disease, TB used to be the leading infectious cause of death worldwide, above HIV and AIDS. After 2020, COVID-19 actually became the #1 infectious disease killer. But as SARS-CoV-2 mortality decreases with the years, it's suspected that TB has again become the #1 infectious agent causing death. So in 2023, over 1 million deaths were attributed to TB, and the incidence was nearly 11 million cases in 2023. This was a continued increase from pre-COVID years, but reassuringly, this increase appears to be stabilizing. So who is at risk for TB? So unfortunately, the burden of TB is not evenly distributed across the world. 30 countries with a high TB burden actually contributed 87% of the world's new TB cases, and 8 of these countries contributed greater than 2/3 of the world's cases. These countries include India, Indonesia, China, the Philippines, Pakistan, Nigeria, Bangladesh, and the Democratic Republic of Congo. And you can see here in this pie chart, India, contributed most of the cases of those 8 countries, followed by the remainder. 80% of TB and HIV co-infection cases are in 7 countries: Brazil, Haiti, Mexico, Peru, Colombia, the Dominican Republic, and Venezuela. You can see the TB incidence here in 2023 is concentrated in sub-Saharan and Central and Southern Africa and Southeast Asia. So when we talk about global health disparities and inequity in TB, you can see we talked about the incidence is concentrated in those certain regions, and unfortunately, mortality, the sort of darker red, is increased in Central and South Africa, South Asia, and Southeast Asia as well. And then there's an important burden of TB that's carried by people who are in prisons, especially in certain countries in the former USSR, Azerbaijan, Kyrgyzstan, the Russian Federation, and Ukraine. People in prisons there are more than 20 times more likely to have reported to have TB than the general population. So when we shift to TB epidemiology in the United States, there are racial and ethnic disparities. So nearly 90% of cases in the United States are in racial and ethnic minority groups, and over 3/4 of cases in the United States are among those who are born outside the U.S. So when we look at the breakdown of TB cases by race and ethnicity in 2023, 37% of cases are in those who identify as Hispanic or Latino, 30% in those who identify as Asian, and 18% in those who identify as Black or African American. When we look at states that contribute a lot of TB cases, 4 U.S. states reported over half of all TB cases in the United States, and this includes California, Texas, Florida, and New York. So these states are also the most populous states in the United States, and they also have a lot of people who have immigrated from other countries, so TB is more concentrated in those populations. And then when we look at TB incidence, we see that Alaska, for example, has a very high incidence of TB, especially among indigenous communities. And then you can see the states that we mentioned with high TB cases also happen to have a high incidence rate of TB. It's important to call attention to other populations disproportionately affected by TB, including those who are in correctional facilities and detention centers, those who are experiencing homelessness, those who are current or former smokers, and those with alcohol use disorder.